Okay, levels 5, sorry. Topics 5. Okay, in the level 4. Alright? So here in the level 4, so we are now with the documentation, observation, reporting, and handover. Okay, so here we are going to discuss about introduction, about definition, about what are the types of the medical records, understanding what are the guidelines, and what are the observation of the nursing assistant, how are we going to do it, what are those kinds of observation, and what else there, information on the medication, the plan of activities, and the daily living, handover, reporting, and observation. So what is a medical documentation? So if you want to take a photo, you take a photo here. So what is a medical documentation? Medical documentation is what we call the patient medical records. So these patient medical records, wow. Now, so you are complete. Okay, so we just discussed, we are just starting now, good you think? Alright, so here, what we discuss about here now is in the hospital, as we said, everybody knows what we are going to do. So whatever we do there, so we will just write down only what is very important. Like in our scenario, so the very important there, as I said, write only at least 20 words. Because everybody else there knows that you are going to feed the patient, insert the catheter. But what you can write here is the date and the time, nasogastric tube inserted, French 14. So, feeding 200 ml, given as ordered by the doctor, no vomiting, tolerated well, and keep the patient in comfortable position. So, how many are those? Only just 3. Okay? So, no need for you to write that you have flushed, you have put the plaster, you have do like this, you have done like this. No need. Okay? So, write it down. That's very important. Only the date, the time, what is that? The procedure. If there is for the vital signs, you write for your measurement reading, and the patient reaction, and the most comfortable position. Write it down because I'm going to take it. Alright. So we are here, we are just starting with the medical documentation. So the medical documentation is, we also call it as the patient medical records. So I will not go in the details. So patient medical records, they are the documentation of the patient, history starting from admission until the time of discharge. That is the patient medical records. Okay, so what are those importance? Number one, it is important for the patient's safety in the quality of care. So whatever you do for the patient, we are going to write it down. The same way as what we did in our procedure, the same that we are going to do for our patient. So what else there? So to communicate, we want to know what, why, and how. Right? So what else? So we need to get things to be done right time, those like the patient rights. Okay? Right care for the patient. In my quality, always to avoid mistake or there is no mistake. So what we have done is we need to do first time, first right. So if you have done first time, first right, there will be no mistake. Okay? Because in quality, we don't blame. We don't have the blaming community. So what we do, because I am with the patient, with the quality and patient safety. So all my work is first time you should always know that you are right, so that you will be preventing mistake. Because if you are just doing it in a hurry, I want to finish my work. It's first time for you to do it, and you did not think about it, you will get wrong. As I told you, wrong in our work is what? You are causing harm to the patient. We want patient safety. Otherwise, you cause harm, you will be in trouble. Anything that you do harm to the patient will cause you trouble. I'm telling you the truth. So if you are just working in your workplace now or anywhere, you are working in a paper, you are working in anything, you do harm to this one, throw it to the garbage. They will cry? Do you think they will cry? No, because they don't have anything. But the patient, as you are always remember, you are the patient. If you are the patient, so, do you think you will do not best of yours? No, you will do the best, right? So always think about it. So what else is there? So we will allow the caregiver to understand the patient condition. So what else is there? We need to do the method of communicating, how to communicate. As we learned in our universal protocol, explain briefly to the patient what procedure you will do. Not coming to the patient, Mama! Okay? So be gentle as you are. So what else? For the CNA or the healthcare workers, so from any legality or the complaints of anything, we must be aware of it. What are the types of medical records, as we said? So we have two. Electronic medical records, or we call it EMR, or the electronic health record, or EHR. So you must be familiarized with those abbreviations. So electronic medical records is in a digital form, means like this. In a digital. Okay? So, means to say, we are going to input everything, encode it, everything. Type whatever, everything that you do through the digital. Means paperless. We are not going to use any paper. It's paperless. Electronic medical records is electronically produce. Right? Next, we have the physical file or hard copy medical record or paper chart. Means we are going to write it down in a medical record chart. So we are going to use a hard copy file and we are going to write. So if ever like we need to write, we need to scan this and upload it to the system. Okay? So to become digital. So what else there? What are the contents of the patient medical records? Means, what are the contents? What you will find in a patient medical records? Number one, the patient demographic. Means, when we call demographic, it's the personal information. Okay? Anywhere that you go, whenever they ask you for something regarding documentation, they start or begin with patient or information. Your patient details or your personal information. So all the date, the name, the date, the birthday, all of those are to be placed in demographic. Patient complaint is the number 2, medical surgical history. So if you will be the one that you will find your patient to start with the medical records. You will do all of this one by one. So, receptionist, if it is big, receptionist are the one responsible to take the patient demographic. History, not the receptionist. It is you or any of the healthcare, like the nurses. So they will ask what? They will ask the history. What is your main complaint? Your complaint is you had a fall last night. There was a fall. Okay, so whatever I'm talking now, we will be using together, combining all together, and we will write down our exercise that you have known. Okay? So as I said, the patient history. You should know that the patient comes always with a complaint. I have a headache. That is a complaint. Okay? So with this headache, the patient wants to know, to let the doctors know that this is the complaint. Next, we have if the patient had operation, so he will tell, I had my operation last night and I had a very painful surgery. So, there was a history. Next, we have the vital signs. You remember now? It's our vital signs time. So, what we do in our vital signs, we need to do what? To perform our vital signs. If normally, we are taking all the 7. Okay? So, especially when the patient is just first time in your center. Okay? So, the 7 vital signs should be there. So, we will write it either in digital or in a paper. If you are in digital, it will be in a digital monitor. And when the patient goes with the doctor will just check on what you have done. But if it is written in a paper patient file, so you will take it to the doctor so that the doctor will just read it and write down. Alright? So what else? The allergy history. Allergy history means anyone, if you are coming to seek medical advice, always they ask allergy. In your COVID, before your PCR, before your vaccination, did they ask you, you have any allergy? They did not ask? Oh my God. They did not ask, really?
I don't remember.
You don't remember. Okay? Because anyone did not ask, that is their liability. It's their responsibility to ask it. And you forgot. They forgot.
Only they were asking the menstruation,
Sorry?
last menstruation,
No.
and then pregnancy.
That was
That's
the
what they
history.
were asking.
There was history depending on your complaint. What is your complaint? Why they ask the menstruation?
Yeah, that's all I remember.
No, what I mean, it depends on your complaint. What was your complaint? This is general. We are asking now, first time to see the doctor. So when you come, you have the complaint, right? So why you will tell the last menstrual period if that is not related to your complaint? If you are taking only the COVID vaccination, are they asking the COVID for the last menstrual?
That's what they asked.
Last menstrual?
When was your last menstruation?
For what?
I don't know.
No, for the COVID?
Yeah, for vaccine. Yeah,
For the vaccine?
Yeah, that's
Yeah,
what they
for the
asked.
vaccine, they asked me last menstrual, the last, yeah.
And
When you
other
have
things,
your
no?
last period.
Yeah, the last period?
Yeah, they asked me.
What is this for the second vaccine? They ask.
No.
For vaccines, not for the test, for vaccine. they
Vaccine
asked
I'm
me.
talking about.
Yeah, they asked.
Yeah, that's what they asked.
History of the menstrual period?
Yeah,
Let
last
me check
menstruation.
from the The criteria, the one that they are asking.
Maybe that would pregnant
Maybe
is
they
not
want
allowed
to,
for the vaccine.
yeah.
Which one?
Yeah. Maybe mom the pregnant not allowed for the vaccine.
For the pregnant, maybe. Okay, but for the pregnant, you have to provide them with the proof that you are positive and you have the initial with the doctor. Okay. But you know already, why you will come here if you are pregnant? Pregnant, we are not giving vaccine, right?
Because maybe they ask when is your last menstruation. If you will tell like last 2 months, 3 months, they have
Feeling of doubt.
yeah, feeling they're doubting that you are
Maybe.
yeah.
Maybe you are pregnant. So anyway, let's check further. Okay? So, but that allergy is there. In any period of your hospital encounter, they are asking for allergy. Because simple allergy reaction with your seafoods or anything, it can cause patient harm. Okay? So, if you did not, because there are many like examples, you missed, and the patient had the injection or something, and the patient had allergy. So, it is not the patient who is going to be what? To be blamed. You, because you are taking the history, the patient details. Alright? So, what else is there? So, as we said, we have the patient assessment. So, anybody of you attended the patient safety? Attended? Not yet? The last time we have taken the recognition, but no patient safety.
No.
Okay. So, alright. So, patient assessment, we want to assess the patient in 3 ways. One is we are going to do our pain assessment, which is the Wong-Baker Faces Assessment, Pain Assessment tool. Second, we have our Morse Fall Risk Assessment tool. So for the patient who are going to have potential to fall. And the last is the Glasgow Coma Scale. Okay? So what we have to do, what we need to do more is the medication and prescription. So we are going to ask, Mama, what medication you are taking at home? So, this will go with our medication in the 3 basic effective of medication management. Okay? So, we want to know whether the patient is taking medication by home or the patient is taking new medication from the doctor. The treatment means giving nebulization. Those are the treatment. Oxygen administration, they are treatment. Procedure, like you did your tracheostomy care, your simple wound care. What else? There are 2 patients' consent. We have the general, which requires patient signature plus anybody from the professional license who will sign for consent. 2. For the informed consent, we have 3 to sign. The patient, the doctor, and the witness. So if the doctor is talking about the procedure to do, you are there. The patient is listening, doctor is talking, explaining, and you are there. The 3 of you are going to sign for the consent. Because you are there, you listen to the doctor and the patient talking. So, it's the patient to sign, the witness, and the doctor. Okay? So, next is doctor's progress notes. There is a piece of sheet that it is only for the doctor. Doctors will order what the position of the patient should be. Doctors will order how much of this nasogastric feeding should be. Those are the orders of the doctor. So, we have the clinical data of information. So, at the end, we have those data, all the reports, x-rays, lab tests. So, all those reports are there together at the backside. What else? The last one, we have the nurses or the CNA nurses notes, or whoever is caring for the patient will write at the nurses nursing care plan, we call it. Alright? Or the nurses notes. So these are all what you will find in a digital EMR, EHR, or physical file. So, in the documentation guidelines, so you should know, one, confidentiality of medical records means you don't tell anybody about your patient. If you two are together taking care of one patient, you talk, you plan. But, if like for example, so Michelle is different patient, and the other is Nilima, different patient, you never talk about it. Okay? It's confidentiality. Medical records is legal. So anything that you write, that will be used against you in the court of law. Okay? What else? Medical record is factual. Only what the patient said or what you observed, you write. Patient said, I have a headache, and you write down, patient have severe headache. Did the patient told you? No. So don't add. Okay? So be factual. I saw the eyes of the patient is red. Do not write that I saw the patient's red is very reddish or highly red. That's what you said, you see. And the patient will just blame you. More did you see? And the more is you did not even examine. Okay? So, factual. Brief, clear, and concise. The one that we did in our procedure. Documentation of procedure is brief, clear, and concise. Okay? What else? Document immediately. Once you have done your simple wound care, now is 0800. And then you forget, oh my God, I forgot. Digital is according to the time. There is a time here. So if you have done it in 0800 and you are going to write at 12 noon, you are late, right? So you cannot write there, 12 noon, I did my wound dressing care at 8. Oh, it cannot be like that. So that's why we said immediately after. Then what you need to do, there is a rule or a policy. You need to write late entry. So if you have written everything, at 12 noon, you will request. Our documentation is automatically logging off. If it is set by the IT at maybe 3 minutes, in 3 minutes, without you logging off, it will automatically off. Log in again. Okay? It will be here in our documentation to prevent access from other people. You get out from this, you are doing something, get out from this, log off. Okay? Because somebody who is angry to you, let me see, I saw her there. And then that happens to the patient, and patient, just with that thing, you did not know that something was written, and that patient, during that time, that patient, something happened. The patient died or something. Your documents, they will not ask you time to sit and complete your documents. All of this, if it is legal, they will take everything out. You will not hold it anymore. Legally. So because if they will give you time, you will what? You will write whatever you want to make it good. No, cannot do. That's why immediately off. Something happens, they will take it to health authority for investigation. You cannot do anything. Okay, so what else there? So we have only approved abbreviation to write. Not do you want this abbreviation, you write it down. No. We have the list of approved abbreviations only. Okay? If you write your own abbreviation that is not with the abbreviation of the standard, useless. They will find it in the legal matters. Why Nilima is writing this? For what is this? You have to explain. Where did you get this? This is my own mom. Alright? What else there? So document in chronological, military time. If you happen, I already did. As I said, if it happened at 13:05, so the next will be 13:30. Okay? You cannot write like 12 o'clock and then after that is 8 o'clock. It cannot be. So what else? Use military time. We discussed about it. What else? No erasure. This is the worst. No erasure, no scribbling, no, what is that? Scribbling, what else? Not to use the white ink. If you are done wrong, mistaken in what you have written it, draw a simple line. And at the end of the line, you sign your name. Okay? So now, the recent now from the accreditation of the Joint Commission, JCI, they want even the time. Very small space. You will write, your sign, and very small. But they want it. So it will be included in the standard line. Alright? What else there? The late entry. I talked to you about. Late entry, you will get a request. This request either digital or handprint. So you will, according to, first you need to let approval of your head nurse. From head nurse, she will send it to the quality. From the quality, it will go to the head, like the CEO or the counterpart of CEO. After CEO approval, back to the IT. IT is the one going to help you to open up your digital file. Okay? Same thing with the hard copy, but only the medical records. It's not the IT. The medical records officer will be the one to help you. What else? Do not leave your documentation not complete. Okay? Once you are done, complete it. Next, do not leave, confidentiality of password access. Do not give it to somebody else. Okay? Be very careful. Log off your workstation or personal computer when leaving. Anytime you leave, log off. Anytime you get access, put a log on. So what else? So we need to write correct spelling of medical terms. So wrong spelling, as I said, is wrong. That's why we have very particular with the spelling. Gives you different meaning. So there are types of observations. There are two types. One, we have the objective. Objective is where I see from all of me using my 5 senses. What are those senses? What are those senses? Our eyes, nose, ear, taste.
Or you mean the organ or the senses?
Huh?
Like sensing organ. Like
Yes, all. There are 5. Okay? The sixth sense, what they call the sixth sense?
Yeah.
Okay, the mental. Okay, that's why those people, they are telling, she have the sixth sense. You can feel, you can predict. Okay, yung mga fortune teller something. They have psychic power. Yes, they have the psychic. The others, they are using the witchcraft. Isn't it? They are learning and they are making the bad way. Okay, they just want to learn. But they are using the sixth sense to their bad, the way they,
Bad achievement. Bad achievement.
how you will tell it as your achievement. My God,
Oh, why you achieve it?
You
They
achieve
feel
it.
satisfaction. Yeah.
you have done it.
Yeah, they feel like satisfied.
Oh my gosh.
To them is achievement.
Okay. Then you can get it a certificate. Witchcraft, no? I don't know. Do they have? You need to learn. Yeah.
They teach that.
Maybe.
But they teach this psychic something, card reading.
That is different.
Yeah.
But the witchcraft is making you bad thing.
Yeah.
Right?
I think that's
So something that they will be in their mind and then they are going to do something with you,
manipulate.
manipulate
You
you.
learn it because it's initiation. So you must learn the process of being.
But that is not maybe
Witchcraft is
formal.
real.
No, it's not formal. Of
Yeah.
course.
Somebody is just, like personal, I will teach you.
Yeah, it's not.
Something.
They
Okay?
say they teach you. It's like say, like without you knowing, like the witch. will,
Hypnosis,
like,
just like hypnosis. So they will put you under the mental telepathy or the hypnosis, and then you are going to follow everything that, something, which is a witchcraft,
In our
I mean-
place, it's a saying that like before that witch is like about to die or something, she will like transfer her all the
yeah.
power to
Yeah.
somebody without
That is
them
a
knowing.
myth. Myth
Yeah,
is
yeah.
not true.
Yes. We
Okay?
believe in that, but we just
Yeah,
say
yeah,
it
but
for
we,
fun.
as, because it is in the culture.
Yes.
Like, I remember now. So you came together, do you know each other? Huh? During your practical, you don't meet each other?
No, I know Farah and but I never meet Farah.
Minimum.
You meet me?
This is it. Because once you are in the level 4, so everybody is coming together in different classes. Okay, so once if you are done the long time in the practical and she did it earlier, so you did not meet.
Yeah.
Okay, so anyway, so meeting. So,
Nice to meet you.
okay, so what's your name?
Her name Jane. June.
Joy.
Oh,
Joy.
sige.
It's very super joy.
So she is.
Nilina.
Okay, so you know each other now. Okay, so anyway, last day for Innocent. So Innocent will be leading this group. Okay, so another day will be coming as you. Okay, so is this your last also?
No, ma'am. Second only this one.
Seconds.
Second.
Both of you. All right. So as I said, we have 2 types of observation. So all of what we are going to talk about here as in the level 4, the same with our practical in the level 3. It is combination and repeatedly we will be talking in every topics that we are going to discuss. Like this observation now. This observation, we will be using it in our recognition. You remember in the recognition? Recognition of, we have done in our
Yes, ma'am.
recognition, right? You recognize when the patient is assessing, you are assessing patient, and you will find to assess using your observation in the way of objective and subjective, right? Okay. So in this objective, so what we need to do here is all coming from us. when we assess or see the patient to observe, it will all come from us by using our five senses. So like for example, as what we have, whatever I see. So I see the swelling of the patient knee. Okay? I have seen the redness of her eyes. What? I felt there is a bump or what do you call this one? Ano ba yung bukol? Cyst or something. Okay? So what else? Like a taste. What will be the taste? The medicine of the patient, I tasted, and it is, bitter, something. What else? The smell. I smell the diabetic patient, smell, the breath smell is, what is the breath smell of the, there is, how do we describe the breath? Acetone breath. Okay? So it smells like acetone. Acetone. The smell
Like
of
there's
this
like
nail
a
polish.
like a chemical
Spirit?
Yeah, just like a spirit. Okay? That's the smell of the acetone smell. The acetone breath. Okay? Diabetic breath. So you will smell how they breathe. Okay? So what else there? Smell. So we have saying ear.
here.
So I heard patient is snoring low. So by your assessment, you can observe and you can write your observations. Next, we have our subjective. Subjective is anything that comes from the patient. So, from the patient, which I don't feel, I don't see. I have a severe headache, your patient said. You did not see that. So, when writing, I have headache, severe headache. Okay? I have chest pain last night. I did not see that. The patient is talking to you. So, getting the information, write down. Patient said, I have severe chest pain. Okay? So, I slept in the bathroom last night. So, you did not see that. It's only the patient talking to you. So, anything that comes from the patient, subjective. So, there are 5 techniques of reporting. So, we are with the handover. Handover, do you have taken? I'll go over. Done? Alright, so patient handover is the transfer of responsibility and accountability. So, from there are 2 persons here in the handover. One who is handing over and the other who is receiving. There are 2 persons. So, now, as we said, we are transferring everything. The care of the patient, medication, all that happened very importantly in your 12 hours duty. Very important only. Otherwise, the rest, you have written in your nurse's notes. Alright? So what is the purpose of handover? Is to help we deliver patient care properly. Alright? So we delivered quality patient care for the patient. Okay? You're done here? We're going back. So there are 5 techniques in handover. So how are we going to hand over? So as we said, be organized. Accordingly, you write down your handover. What else we need to do here? So we need to stay focused. So when giving over, you are to, either you give it to your patient on bed, that is we are calling as bedside. So if you give it to 3 or more of the people, you give it what? On a team or on a part of your team. Okay? So either you give it in a visual, like I'm giving you here. Room 5 is blah, blah, blah. Room 6 is blah, blah, blah. Okay? So here, so there is also communicate clearly. You clearly communicate, maybe you are talking differently. Write it down, so make sure that you have a document. Be patient-centered. Talking about during the giving over or the handover, don't talk sideways. Don't talk about marites. Okay? Just talk about your patient. Okay? What else? So allow time to report or to hand over. If you think like you have lots to hand over, give time. Not only 1 minute. Okay? That patient, no. You cannot understand. Okay? Just give time during the handover. Okay? So the other types of patient handover, as I said, is verbal, when you are talking about both of you with your clinical bedside or the side of the patient. And we have the written, like there is a written logbook or something that you are writing down, not to forget. So now about the patient medication, I'm not going to touch in here because we are going to talk about it more in the medication and diabetic management. Alright? So what we are going to do here is, you need to properly explain, as we said, you start with your what? The patient rights. You have to remember that. Patient, types of medication. What are the routes of medication, the abbreviations, what else there? You have to review all of those. And the rights of administration of patient, as I said. So now, in the CNA, we have a nursing care plan. Our nursing care plan is the one that you have. Okay, so we are going to complete our exercise with the nursing care plan. So our basic function is our ADM, right? To perform and support and assist our nurses in performance of our ADM. Okay? So we know our ADL. So the topics of our ADL are all what we have done in our practical. So for this reason, okay, so we have our ADL on the first row, in the first column. Okay? So the second column here, it's all about our perform time. So just imagine yourself, you are on duty at 12 hours. Either it is morning or it is night. Okay? So what you should do in your perform time, like for example, bathing. So here, you should write your timing. Your time, not me. Okay? So as if, imagination, you are there in your duty. So here in the bathing, I'll give you an example. We did the handover between 7 to 7:30. Okay? That's our activity, the handover. So, I will start, I will fix myself, I will fix this plan, so I will start my work at 8 o'clock. Either, maybe it's morning. Okay? So, your duty is from 7 a.m. to 7 in the night. Normally 12 hours. So now, I will start my work with bathing. Bathing in the morning, let's say, I will write for my patient bathing maybe by 10 o'clock. Right? That's mine. So it's up to you. So in 10 o'clock, I will write in a military time. Okay? So now, with the next here is the patient action. In bathing, I wrote 10 o'clock. I come to the patient. Baba, I will make my plan. Baba, 10 o'clock with you, okay, I will give you bath. Baba said, no, I don't want today. So, no bath today. Yeah? So, how are you going to convince your patient? Okay? Baba, so it's not good with you. You will be smelling. The doctor will come and the doctor will get angry on me. Like this. So, just do sample. And because the patient action here is refusing. He refused the 10 o'clock. So, you compromise with the patient, Baba. Because what time do you want? So, Baba said, maybe 2 o'clock. So, change it with the 2 o'clock that you have already planned. Before you come to the patient, everything is done in your timing. Okay? So, patient agreed. 2 p.m. Bathing. Patient action agreed to take bath. Now, the last here is your patient outcome. Now, what will be if you have given bath? Just think about it. So, what will be your patient
Clean.
outcome or evaluation?
Clean and clean.
So? Don't write down clean. Just simple word that patient is clean or patient is smell good. Okay? Don't write only the adjective clean, good, beautiful. Okay? You have to write so that everybody can understand you. Okay? So this is our, so you know now. Any question? Alright? Alright. So going to our nursing assistant, this is our care planning. In our care planning, according to the scenario I'm going to give you now, okay? So you better pick up, select, or choose your scenario, and then just get a scrap only, a draft one, and then write all what you have taken as subjective and objective. Okay? So objective, write it under objective, and subjective, you will write it under subjective. So the next here is your intervention. If like for example, subjective, I have severe headache. So your intervention is action. What action you do? Gave cold compress, right? Or given Panadol as doctor's order. Okay? Now, on the third, rationale. Why? This is why you give the Panadol.
Patient have headache.
Reason why you gave the headache.
Panadol, ma'am.
Oh, why did you give the Panadol?
To relieve from headache.
To relieve from headache. And the last is your evaluation. What happened when the patient is relieved or no?
Patient now relieved.
So,
Patient comfortable.
comfortable or the patient is happy. So, your imagination is according to, based on what the patient is done. Like she had it, and now what she said to you, I'm very happy now, I'm relieved. So patient is relieved. Okay? Or no more headache. So patient said, no more headache. Okay? Quote in parentheses, no more headache, feeling happy. Right? Same way with your objective, subjective. Okay, thank you. Now let's move. I'm going to give you a scenario. I'm going to give you a situation. So, now your patient is coming. This patient came to you. Okay, so you remember that we are going to get the history of the complaint and everything. Okay, so with that complaint, that will be your subjective and objective. So first thing, when the patient came, from far, you have seen the patient walking with a swollen knee. Okay, so by the time the patient is coming to you, you saw that the patient eyes is so red. And when the patient came, so you find the skin like there is allergic reaction. Okay, so when the patient came, you talked to him, he said, last night I had a fall and I had a bruise or the black. You know the bruise, the hematoma? There is a black on my shoulder. The black color or the bluish color in my shoulder.
Bluish spot.
Bluish spot or bluish color. Okay? So when he came to me, and I also noticed that the patient told me that he had a pain on the hips. You remember he had a fall, right? So he had a painful hips. And the last one, he told me that I have abdominal pain. Okay, that's all. Okay, so what do we have there?
First two.
Or what you're talking about, subjective or objective? You tell me first. Subjective, is it the number one is subjective?
Objective.
Yes.
Objective. First is
Okay, objective. Okay, we'll talk about. No, number one is subjective.
Yes, ma'am. Subjective.
Okay, write down what you have taken in subjective. What are those subjective from the patient when he came and talked to you?
Patient.
What you got?
Oh,
Michelle, what you got?
For the subjective, ma'am,
One by one.
Yeah,
Give me
according
one.
to the patient said I had a fall. I have a bruise. Patient said he has painful hips, and he said I have abdominal pain.
Okay, so for her, like this. What about you? Subjective.
I got confused.
What you were confused?
Subjective is from
According to the patient.
according to the patient, right? So now you want to know the objective? What
Sub.
I see?
We're talking about subjective now.
Oh, subjective?
Okay.
Yeah.
So what you have, your patient came and he was giving you the subjective observation.
Yes, the patient said that last night he fell and then he got bruises on his shoulder.
Okay, so there we will write, I have bruises on my shoulder. Okay, what else?
And then he has hips and abdominal pain.
Okay, one by one.
He has
Okay.
pain on his hips.
Okay,
and
so
also-
I have pain in my hips. That is open and close parenthesis. Huh? It's not you talking, it's the patient.
So while we're writing here, we write like that, right?
Yes, that's
I have,
it.
I
I
have.
have and then close and open and close. Okay, and the last is I have
Abdominal pain.
abdominal pain. What about you, Innocent? Same?
So we'll
Yes,
write
sir.
it here.
The patient
Yes,
said,
now you write it
I
there.
have for last night.
Okay,
I have bruise on my shoulder.
okay,
I have pain on my hips, and I have abdominal pain.
okay. So those are subjective. What about you, John?
Same.
The same.
Yes, ma'am.
So, shoulder.
The patient had a fall. I have a fall last night. I have bruise on my shoulder.
Okay,
I have a painful hip,
okay.
and I also have abdominal pain.
Okay, so good. So now you have taken those subjective symptoms or subjective observations of your patient. Now let's move with the objective. What is the objective or what are those objectives? Gemma. Gemma.
For the objective, ma'am, patient has swollen knee, patient has red eyes, and patient have allergic reaction.
Okay. So only three?
Yeah.
Okay. You?
Yes, same. Patient came walking with like swollen knee, and I saw the patient has red eyes,
Red eyes.
and the patient is having allergic reaction. I saw on the hand.
Okay.
Is it hand?
Yeah. Three
Yeah,
only?
that's three.
Okay. What about you, Innocent?
The same.
The same.
Swollen knee, swollen arm, and allergy.
Okay. Surgery, same. All right. So all of those, now we will go with the second and the third. So what else there? Intervention. What did we, okay? What did we do? What do we do? What action? Okay, what action you do? Sorry.
We write this.
Just imagine what you will do, with those situations.
Here intervention for all.
Yeah. For example, the patient's
Intervention, give painkillers. Painkillers.
You will say painkiller, like Panadol or something, by the order of the doctor. We are the one giving only, but it's always the doctor.
So different intervention for
Yes.
all this.
Yes. So
If
it's up to
fail,
you.
then what?
Like for example, what you are,
If
the
you fail-
actual, like just imagine what if you will encounter all of this. So what you will do to your patient?
So patient did not fall there. So already happened last night.
Yes.
So we don't need to do anything, right?
So only but all of those are the happenings of the patient or what patient had given you the subjective or the objective. So that fall, he had the fall, what's the history? Okay, the history. He just came and then he told you, I had a fall last night. Okay? So what happened with the fall? So that is the result of
Check
all the
concern.
falls. You have the bruise, the patient had
Yeah.
like this, so all of those. Then what you will do now?
For the bruises,
in my shoulder.
using ointment.
This one,
So?
the
you use ointment for
Yeah,
bruise,
ointment.
right?
So what is the for the ointment? What is the medical term? I haven't heard.
Yeah, just like, first thing that you should know, not only the medication first. You should do the remedy, something the first action. If there is bleeding, so you have to, what? Stop the bleeding, right? So that is the action. Now, this is, think of the action first. So if the patient have a headache, definitely what you do, you put an ice cup, isn't it? That is the traditional, right? You are putting a cold compress here for the headache. Then you will check
Topic.
whether does it relieve your patient or no.
You're searching
Then
for
the
that.
next,
Yeah.
it will be your Panadol.
No need to
There are
write
steps
it
also
here.
when writing. Not
Because it-
not only just to give something like
Applied,
this.
applied an ointment.
According to the doctor's applied.
So for intervention, you can put like stop the
Already done.
bleeding.
Yeah.
Intervention.
Yeah. But what you did in your stop bleeding? What you did there? You stop the bleeding, you said. But what you did? What action you do?
According to the doctor's order.
So, applying a gauze. What you did, your action. Main action. Because that stop bleeding is what? Is still with your mind, right? You did not do anything yet.
Applied ointment according
So, do something
to the
To
doctor.
relieve from pain.
to put an action in what you think.
For
If
this-
there is bleeding, definitely what I should do, or I
Will
go
that
take
infect
ice, something,
to heal?
okay?
Hmm.
So that will give you now this thinking. You are now with the patient.
To relieve from pain.
So if something happens to your patient, what you do?
Relief from-
There is a bleeding. To stop the bleeding, what you will do with
What
the
do you
stop?
give to it pain? Painkillers?
Painful hips.
If it is amputation, what? You apply tourniquet, right?
Painful hips for the eye and for the eyes. Eyes. What is that? For the-
Ice pack?
Yeah, ice pack.
Or hard pack?
Or the
Make sure your answer are different, huh? Both of you.
From terminal is this